Hello, good evening, and welcome to the Functional Medicine Solution podcast. And my name is Tal. I'm the Educational Director at the American Academy of Functional Health. And with us, we have Dr. Chill.
Hi, everybody. Welcome.
And as usual, both me and Dr. Chill, every Wednesday, we kind of join forces together and broadcast to you from the West Coast to bring you the best of functional medicine, the root cause approach, and natural solutions for your patients' chronic conditions. And we're really blessed to have Dr. Chill with us. He's a functional medicine physician with years of clinical experience, and he's going to be sharing a lot with us today about functional, nutritional, and different approaches to helping your patients. So this is going to be a really important topic today. And today we're going to talk about gestational diabetes. And this is a big topic. We know that it's a topic that those patients need as much help as possible, right? So we know that this is a very important topic. And we're going to talk, both me and Dr. Chill are going to talk about some really cool studies that came out that talk about the root causes of potential root causes and risk factors in gestational diabetes. We're gonna go beyond the risk factors that are well known in the medical community. We're gonna talk about the 3 root causes in functional medicine. We're gonna talk about some nutritional strategies that can help your patients. And as usual, what I really want you to get out of it is the clinical application. So not just understanding what's causing gestational diabetes. We're going to talk about today about 3 of the major root causes or triggers. And there's more triggers. We're going to talk about 3 major ones. But I also want you to learn and take for yourself into your practice some of the strategies that can help your patients. So if you want to learn about the root cause of gestational diabetes and some treatment strategies, you're in the right place. So as a general overview, gestational diabetes is a condition when there's too much sugar in the mother's bloodstream and it's passed through to the baby. And then the baby then has to increase its own insulin production as well to help with the excess sugar. Now, remember that insulin is a growth hormone, right? Which could impact the development of the baby and increase the adipose tissue. And there's other multiple risk factors that can come with gestational diabetes, right? So we're talking about preeclampsia, which is a dangerous increase in blood pressure during pregnancy. We got labor complications, right? There's preterm birth. There's still risk of stillbirth or birth defects. So this is a really important condition to learn how to manage or learn how to provide some additional guidance to those patients. And of course, when it comes to symptoms, it's a really interesting condition because very similar to diabetes, some patients might not have or notice symptoms, right? So while some patients experience excessive hunger, thirst, dry mouth, or fatigue, there's other symptoms, of course, such as frequent urination or recurrent yeast infection, but some patients might be asymptomatic, right? So let's start with taking a look at the patient survey, really interesting patient survey that was posted by the Gestational Diabetes UK, where we can see the major risk factors very, very clearly. So let's take a look at that. So here in this particular picture, we can see the risk factors, and you can see that on top, there's a BMI of over 30. And this is based on a patient survey that the Association Gestational Diabetes UK have done. They surveyed over 1,700 pregnant women who were diagnosed of having gestational diabetes. Now, really interesting to mention that obesity is it's a major risk factor. So BMI over 30 And then, of course, genetic predisposition, such as family history of diabetes. We also have family origin of South Asian, Black Caribbeans, previous babies that are weighing over 10 pounds, previous gestational diabetes pregnancy, PCOS, women who are pregnant after the age of 35, or if they went through IVF pregnancy. And then 11% of those who were diagnosed with gestational diabetes marked that they had none of those risk factors. And then we also have a little bit of increase with multiple pregnancies. And of course, with functional medicine, we know we can go beyond genetic predisposition to learn about what's actually triggering or turning on those genes of disease. And so there are several factors that we're going to talk about today in the realm of functional medicine. And of course, Dr. Chill is going to take us in to the what would that look like? So we're going to talk about 3 major factors that contribute to the development of gestational diabetes. We're going to look at some really cool studies. We're going to look at some nutritional strategies. So, Dr. Chill, I know it's a big topic, but we want to get as much as we can in our time together, and also discuss information that they can already take and use tomorrow when they're seeing patients, right?
Absolutely. So we definitely want to provide some high level points of gestational diabetes that are going to be really impactful for your patients. If you're in reproductive health, if you're working with peds, right? So this is going to be really beneficial information for you to understand, so you can relay this information for your patients and help prevent some of these issues from a functional medicine perspective by looking at some of the contributing factors, the contributing functional medicine factors. And one major factor is going to be chronic inflammation. This is going to be a major risk factor for gestational diabetes. As a functional medicine practitioner, I feel like we are inflammation investigators, because chronic inflammation is involved in so many disease processes, and gestational diabetes is going to be another disease process that this is involved in as well. Recently, researchers have identified that inflammation, along with oxidative stress, sometimes they go hand in hand, these play a significant role in the development of gestational diabetes. And then it has potentially harmful effects, both short and long term. So if a pregnant mother has subclinical systemic inflammation, their levels of inflammatory cells, such as monocytes, neutrophils, pro-inflammatory cytokines, these can all be upregulated. And it was found that patients with gestational diabetes, they have higher levels of these inflammatory markers. So let's take a look at the picture from the Journal of Antioxidants, just to dive into this factor a little bit more and the subclinical systemic inflammation. So here we can see the inflammation and oxidative stress processes. This is during and after pregnancy, right? And in the middle here, you can see the increase in inflammatory markers, mostly IL-6 or interleukin 6 and 8, and tumor necrosis factor alpha or TNF alpha. And this all occurs during pregnancy. Inflammation also is going to increase the levels of reactive oxygen species, or ROS, and this can damage our cells, our pancreas. So in particular, the beta cells in our pancreas, which helps to maintain and regulate our blood sugar levels. These are all associated with insulin resistance. So it's this combination of systemic inflammation, oxidative stress. This can all increase the risk of metabolic dysfunction and complications such as obesity, preeclampsia, and preterm labor. in our patients. This is why it's really important to understand some of these risk factors, and these are the markers that we can actually look into and test for our patients if we're suspecting they might have chronic inflammation. Now, where is this inflammation coming from? There are multiple factors that can stimulate the production of inflammatory cytokines by the cells of the immune system and the placenta and the adipose tissue, right? So what occurs is, as the placenta and the adiposity increase during pregnancy, there is an enhanced secretion of pro-inflammatory cytokines. So if the mother already has chronic inflammation, they can develop a higher degree of oxidative stress. So additionally, what occurs is that high glucose levels will also stimulate the activation of inflammatory pathways. So this becomes a vicious cycle where the oxidative stress triggers high glucose levels, or the high glucose levels continues to increase oxidative stress, thus increasing all of the inflammatory pathways, creating other risk factors for the pregnant mothers. Now, let's do a quick quiz for you regarding systemic inflammation and oxidative stress with these chronic risk factors. So, the question is, how do we reduce systemic inflammation and oxidative stress? Do we do it by one, reducing sugar and processed foods? Do we do it by two, increasing vegetables and fruits? Or three, increasing consumption of omega 3s? Or finding the root cause that drives inflammation? Or eating more meat and chicken to get more protein? Six, all of the above. Or seven, all of the above besides number five, which is eating more meat and chicken to get more protein. I will give you a few moments here. I feel like we need a game show music to go during this. So the answer is number seven, all of the above besides number five. This is because when you're eating more chicken and more meat, this can actually increase the levels of omega 6s. This can change the ratio of fatty acids in our bodies with the omega 6 to omega 3 ratios, which we dive further into in the program, in the Advanced and Clinical Functional Medicine program. And what occurs when you're eating more omega 6s is that this triggers more inflammation. It triggers the immune cascade of inflammation, and this is going to cause more chronic issues for your patients. Now, what can be beneficial for these inflammatory processes with these patients is omega 3 supplementation. So it goes down the anti inflammatory pathway. And this was reported to improve glucose and lipid metabolism and reduce insulin resistance and C reactive protein, which is a marker of inflammation. And this all occurred in individuals with gestational diabetes. And the dosage that should be used is 1,000 milligrams per day. And here is the study if you want to read more about that. This is called The Effects of Omega 3 Supplementation on Glucose and Lipid Metabolism in Patients with Gestational Diabetes. And this was a meta analysis of randomized controlled trials. And this was published in the Journal of Diabetes and its Complications. Other approaches that you can use with your patients or refer your patients to use is the Mediterranean diet or a plant-based diet. These are all high in fruits and vegetables and fiber, whole grains, lots of antioxidants, and low in minimal and animal protein. This can be very helpful before pregnancy or in early pregnancy in reducing the risk of the development of gestational diabetes with your patients. So you can look at giving them omega 3s or having them do a Mediterranean or a plant-based diet or a combination of the two to really reduce the risk factors of gestational diabetes.
Thank you, Dr. Chill. So now we understand better how, and I like the way that you explained it, right? If they have inflammatory markers, inflammation will feed that oxidative stress. That oxidative stress will feed that inflammation and that ongoing damage to the pancreas, the increasing the insulin resistance. So that's all really important for us to know. And with such a simple, like if we do simple strategies, that's really what we're looking for our patients, right? It's like simple strategies to help reduce inflammation and oxidative stress, right? And we don't have to even like, we can start with the simple and go deeper into more precision medicine later on. But at first, we just got to reduce that inflammation and oxidative stress, right? So, eating more fruits and vegetables, more of like Mediterranean style diet. And then omega-3s are simple. It doesn't cost, it's not very expensive. You get a good quality professional grade omega-3. It's like in one soft gel. Good product can give you like 1 to 2 grams of omega-3s. So that's wonderful recommendation. Thank you. So let's dive into factor number 2 that unfortunately doctors don't talk about when patient is diagnosed with gestational diabetes, and that is gut microbiome. So gut microbiome is it's a big topic. And gut microbiome, we talked about gut microbiome in previous discussions. This is one of the major parts. And we know that so many metabolic diseases start in the gut. And we know that the gut microbiome is really important. We got trillions of different bacteria. It's a whole ecosystem in our gut, right? So we have more of those bacteria than we have cells in our body, right? And we have this symbiotic relationship where we help each other to maintain function, healthy function. So let's warm up with a little quiz before we dive deeper into what's the connection between gut microbiome and gestational diabetes. So the question is, which of the following is not true about the role of the gut microbiome? And I'll give you a few options. So option number 1 is digest some carbohydrates. Option number 2 is the gut microbiome regulates our metabolism and body weight. Option number 3, gut microbiome produces vitamin K and vitamin C. And option number 4, our gut microbiome regulates our immune system. So we got 3 answers that are correct here, and 1 answer, which you need to find out what it is not true. So which one is it? I'll do a little background kind of ticking music for you. Tick, 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 tick. So which one of those is not true? I'll give you a few more seconds. You can put it in the chat. Okay, so when we look at the gut microbiome, the correct answer, what it does not do is produce vitamin K and vitamin C. So we know that the gut microbiome helps us with digestion of some carbohydrates. It helps with regulates our metabolism and body weight, and it also helps regulates our immune system. And it also produces vitamin K, but it does not produce vitamin C. Our body in general cannot produce vitamin C. We have to get it from diet or supplements. And we know that vitamin C is important for tissue regeneration, repair, healing of wounds, and also supporting our immune system. Now, just as a kind of a funny little something that I wanted to mention is that while we can't produce vitamin C, we have to consume it. Goats can actually produce 2 to 4 grams of vitamin C every day in their liver, which is really fascinating. I always kind of liked goats, especially when they're young. They're kind of cute, but it's really interesting to mention that they can produce vitamin C in response to stress. So our gut microbiome, so going back to the gut microbiome, is really important for regulating our immune system, as we said. There's also a big topic that we're not going to get into today, but the gut-brain axis, the microbiome gut-brain axis, which also explain how our gut microbiome can also impact our neurological function and also our endocrine system, right? We're not going to get into that. We got a whole class about the mechanism, evaluation, and treatment protocols in the advanced and clinical functional medicine program. But for now, let's take a look at some at the changes that occurs during pregnancy, so we can understand what's really happening when somebody gets pregnant. Like, are the changes that can occur in their physiology? So this is a picture from the Journal of Translational Medicine, was published in 2023. So essentially, what you're looking at here, on the top, you can see the different hormonal changes from first to third trimester. You can also see underneath that, I marked for you in blue the changes in microbiome diversity. And you can see some bacteria increase, some bacteria stays the same. For example, Firmicutes species of bacteria stays about the same. You can see them right kind of like really close to the bottom line, the dotted line, and they stay about the same, while some bacteria such as proteobacteria, actinobacteria, they might increase over time. But in general, what we're seeing here is that the microbial diversity reduces as the woman proceeds in her pregnancy. Now, we also see changes in the vaginal microbiome and oral microbiome. And by the way, there is an interesting report that shows that if you got changes in your gut microbiome, that could lead to changes in the microbiome of your mouth and the microbiome in the vaginal area. So that's important to know, because that's one way we can kind of impact the organisms that live inside us, kind of all throughout our body through the gut. Now, we can also see in the anti-inflammatory state. So we got inflammatory state, and then we got it in a healthy condition. We got anti-inflammatory cytokines such as interleukin-10 on the bottom. On the bottom left, we have Tregs, T regulatory cells, which all of them essentially what they do is like they reduce inflammation, right? We don't want too much inflammation during pregnancy because obviously we don't want those cells to attack the fetus. So we don't want too much inflammation. We want to reduce that inflammatory reaction. And now here's the problem. When we look at this, we understand that microbial diversity reduces, and we have to have some inflammatory cells, anti-inflammatory cells throughout pregnancy. But what happens if a pregnant woman, her gut shifts from healthy to unhealthy state? That could be changes in the gut microbiome due to their diet, lifestyle, hormonal changes, or other factors. It could lead to altered gut microbiome, or what we refer to as dysbiosis. So let's take a look at this really interesting study that shows us what type of alternation, gut bacteria alternation or dysbiosis, can occur that is associated with gestational diabetes. So the next picture we're going to take a look at is from the journal Frontiers in Molecular Bioscience in 2024. And essentially, you're seeing on the top the changes in the mother's gut microbiome. And on the bottom, you're seeing the impact that it might have on the fetal microbiome, right? So on the top, you can see the pathogenic or imbalance increase that is associated. So, for example, we'll take an example, 2 of these species of bacteria. So if you have a reduction, you see in the green there is a reduction of the beneficial bacteria, right? So lactobacillus plays a significant role in glucose metabolism. It actually helps to regulate blood sugar levels through its ability to ferment glucose into lactic acid, which potentially improve insulin sensitivity and reduce inflammation in the gut, right? This could be really important to prevent gestational diabetes, and it's also important for women who already were diagnosed with gestational diabetes, right? Now, another important bacteria that we look at on the top is Firmicutes. Firmicutes is a species of bacteria that was found to be associated with weight gain through different mechanisms that we're not going to get into right now. But essentially, what we understand when we look at this interesting picture from the study is that if a pregnant woman goes through pregnancy or even before pregnancy, they have a shift, an unhealthy shift in their gut bacteria, which means they have less of the healthy bacteria, or an increase of the pathogenic or imbalanced bacteria, that can shift their metabolism, right? Because it puts them in a place in which now it's harder for their body to metabolize glucose properly. So that's one thing. And we have specific lab testing. There's multiple labs like GI360, or there's multiple different labs that can give you a snapshot, and then we can teach you how to read it, how to read the bacterial metabolites, how to read specifically like what are the specific treatment protocols, right? So that's something that we teach you in the advanced training, but I want you to understand the principles of it because that's really important. Now, if you want to read more about this really interesting study, it's called Gestational Diabetes Mellitus, the impact on fetal neurodevelopment, gut dysbiosis, and the promise of precision medicine. Now, on the right side, you can see that the authors, the researchers mentioned DHA, and essentially they're going deeper in their article into the microbiome gut-brain axis, which kind of talk or connect the gut to the brain and help us to understand neurodevelopmental and neuropsychiatric disorders, right? Which could impact the baby for the rest of their lives. And they're talking about essentially how DHA, which is a type of omega-3 fatty acid, could support both gut health and brain function. And of course, if you're interested in learning more about the topic of gut-brain axis, diagnosis, and treatment protocols, we dive into it in the Advanced in Clinical Functional Medicine Certification Program. Now, the most appropriate way to address these imbalances is, as I mentioned, is when you suspect that the patient has these imbalances, it would be helpful when indicated to order the specific lab test. You can order a snapshot, stool analysis of the gut microbiome. We want to do a comprehensive stool analysis that includes a review of DNA plus culturing. And there are some specific or specialty lab tests that look at both of those. They will culture, they will look at the DNA, and they will tell you specifically, here's how much they have of the beneficial bacteria, here how much they have of the pathogenic or imbalance. That gives you a snapshot of what's the dysbiotic score. And from there, we can help our patients. This is really what we call more targeted therapy. The authors of this study called it precision medicine. And it's really what we hope to, that more and more healthcare practitioners will learn. We have currently about a little bit over than 240 practitioners who joined the program, the advanced program last year, among other programs that we offer. And they're now learning how to offer precision medicine to their patients, right? So a lot of them are physicians, a lot of nurses, nurse practitioners, PAs, pharmacists, right? So this is it's a great movement in the right direction of helping patients to optimize their health. So, Dr. Chill, I know that gut health is such a big topic, right?
It is. It is. This actually kind of leads into our next factor because these are kind of all contributing factors that are connected to each other, right? We talked about inflammation, we talked about gut health, and what occurs if you have an imbalance in your gut health. Sometimes nutritional deficiencies can occur. And why is this important in gestational diabetes? And this leads us to factor number 3, which is what I stated, nutritional deficiencies. There are several important nutrients that our bodies need because it's needed for glucose metabolism. So, for example, here, there are vitamin deficiencies such as vitamin E, vitamin C, and vitamin D. If you have insufficient levels of those vitamins, you are at an increased risk for gestational diabetes. Now, what about minerals? There are minerals that are associated with properly absorbing glucose, or I'm sorry, properly metabolizing glucose as well. These include selenium and zinc. And if you have deficiencies or insufficiencies of selenium and zinc, this can also increase the risk of gestational diabetes for you. So I want to dive a little bit further into some of these nutrients, and we can do that through showing you a picture. This was an image that was produced from the Journals of Frontiers in Nutrition, and this was published in 2022. We can see here that vitamin D deficiency is a common complication during pregnancy, and it may increase the risk of developing gestational diabetes. It's a fat soluble vitamin that improves insulin sensitivity that we see in this image here, and glucose intolerance or glucose tolerance. We also see nutrients such as myo-inositol, right? This can help increase the action of endogenous insulin, and it can reduce the insulin resistance in our patients. We see on the bottom right here fatty acids and fish oils, in particular omega 3s, because those are going to be more of the anti inflammatory omegas. This can help with utilizing and increasing the utilization of the peripheral glucose in our patients. And then probiotics. Dr. Cohen talked about the imbalances and all of the different microbes that are responsible for helping us maintain a proper glucose balances in our body. And with probiotics, this can help to modulate the gut microbiome, which can help to maintain the glucose and lipid metabolism in our patients. So these are all of the nutrients that we need to consider for our patients and assess if they may be deficient in it. Now, this is a really interesting study with vitamin D and gestational diabetes. There was a study with pregnant women who had at least one risk factor for gestational diabetes. They received about 5,000 units of or IUs of vitamin D every day for 26 weeks. And what the results showed was that vitamin D supplementation in the first and second trimesters of pregnancy was effective in reducing gestational diabetes and glucose metabolism as measured through a glucose challenge test for these patients. Now, what's interesting to mention is that there was no difference between two groups in terms of vitamin D in their blood tests, but yet close to 35% of the placebo group was diagnosed with gestational diabetes, while only 12% of the vitamin D group was diagnosed with gestational diabetes. And the dosage again in this study was 5,000 IUs of vitamin D with these pregnant women. So how can this be incorporated into your clinical setting, right? With the nutrient deficiencies, you could either, if you have a patient who is wanting to become pregnant, or if they're in their first and second trimesters, you can look at giving them vitamin D supplementation to help with reducing their risk factors. Or you can also do some lab testing for them. There is a micronutrient panel that you can do that will actually assess for the nutrient levels in the white blood cells. So this is showing what the cells are actually utilizing, right? And so it's going to look at vitamin C levels, vitamin D levels, vitamin E levels. These are all the vitamins that are responsible and needed for glucose metabolism. It's also going to look at the mineral levels, right? The zinc, the selenium that is also needed for the glucose metabolism. It can actually even show you the amount of omega-3s that may be needed, or there may be a imbalance of the omega-3 and omega-6 ratios. Now, this is the precision medicine that Dr. Cohen was talking about. When you do labs such as the micronutrient panel, this can make it really precise in terms of the treatment approaches that you can use for your patients. Because what's great about those lab results, it's going to show you what you're sufficient in, what you're insufficient in, what you're deficient in, and it's going to give you great recommendations, both from a food perspective and then also from a supplement perspective. So you can give your patients precise recommendations, and you can give them options on how to increase their absorption rates and then increase their profiles, their nutrient profiles, so it can decrease the risk factors for gestational diabetes.
To chill for those recommendations. And now we kind of understand with looking at these studies that there's a lot that we need to consider. Of course, today we talked about three major factors, right? We talked about gut health, that's a big one. We talked about the inflammation, oxidative stress, and then we also talked about you just mentioned a simple example is just how 5,000 units of vitamin D was found to be really beneficial for those patients. So imagine you combine like each one of those strategies, right? Omega-3s, and then you combine vitamin D, and then you look at some other nutritional deficiencies, and then also look at what's driving that subclinical systemic inflammation, right? What's the root cause of gestational diabetes beyond nutrition, beyond lifestyle factors, right? That's where all of us come into play with kind of looking at the patient's environment and medical history and figure out where they are right now, where do they want to be, and what is holding them back, right, from gaining better health, regaining their health. So, and there's an interesting question that we got asked, and I want to make sure that I address that question. So the question is, with the mothers who are have symptoms of SIBO, which is small intestinal bacterial overgrowth, or SIFO, which is essentially an overgrowth of fungal in our gut, could adding in extra probiotic cause more dysbiosis? Is even a good bacteria in excess can cause imbalance? So that's a really good question, right? Because there's a lot of different myths out there when it comes to probiotic. So we're going to dive a lot more into probiotics in the functional weight loss program, and also more specifically the advanced functional medicine program. But I wanted to just take a couple of minutes and talk about probiotics. Probiotics are support aid tools, right? Probiotics are not necessarily intending to provide a solution as a single thing for any condition, right? They are very beneficial, and as we take you through the advanced program, we show you how this specific species of probiotic is really good for chronic joint pain, or for Alzheimer's, or for diabetes type 2, or in the functional weight loss. We talk more about probiotics specifically for weight gain and metabolic dysfunction, all of that stuff. But I want you to think about it as a support tool, because what we're seeing is that probiotics, once we stop taking the specific species of probiotic supplementation, essentially what happens is our body eliminates them, right? Through the bowel movement, there's some studies that show that there's a very rapid elimination of those probiotics. So we know that they're not, if we take a really awesome product, professional grade, 70 billion, 150 billion, like 11 types of species, beneficial species, once we stop taking them, it'll be eliminated out from our body. So they don't reside in our body after we stop taking those probiotics, unfortunately. So how do we see probiotics, right? We see probiotics as a support. So, for example, if somebody comes to see you with SIBO or SIFO, right, or some sort of dysbiosis, and that dysbiotic situation led to endotoxemia or chronic inflammation, or that dysbiotic is damaging the integrity of their gut barrier, right, or the function of the gut barrier, you can use probiotics to help them while you fix the underlying cause, right? So, for example, there's a really good, just to give you one example, there's a very specific probiotic species. It's called Lactobacillus rhamnosus, GG, and it's very famous in research articles for intestinal barrier, supporting healthy intestinal barrier function and integrity, right? So when you find out on a lab test or a patient have those symptoms, you can put them on Rhamnosus GG, because it will help to clear the barrier, right? So they're not continuously getting that insult, right? That leaky gut is not continuously happening, and they're not keep getting those lipopolysaccharides and other bacterial byproducts into the bloodstream, and then it causes an immune reaction with their immune system, right? They cause more inflammation. So we can temporarily help with mitigate different situations, right? Even weight loss. Like we'll teach you in the functional weight loss program, we'll teach you 2 probiotics that were shown in research to reduce between 3 to 8% of body weight in like 4 months without counting calories, without any of that stuff, right? Just by introducing 2 species of probiotics into our gut. That's quite incredible, right? The problem is, and that's the disadvantage, is that we have to address the root cause. So if you have a patient with SIBO or SIFO, right, some sort of dysbiosis, then the probiotics, while some probiotics have, of course, they have some antimicrobial effect, or some probiotics have even antifungal effect. Some of them bind to the toxic, the bacterial toxins. Some of them compete with other bacteria in our gut, right? But they're not a substitute to a antibacterial treatment. And when you go through the functional medicine training, we do show you very specific protocols, and those are herbal medicine protocols, and we show you in human clinical studies how they're comparable to the prescription antibiotics, right? So if you decide together with the patient to choose an antibacterial or antifungal therapies that are more natural instead of going to the antibiotics, which can destroy our healthy bacteria as well, we give you that option. We teach you how to use it. We show you the clinical study. We show you the recommendations, right? And you can educate the patient, and they can buy it and start that therapy. But it will not be replacement. And worse than that, if you give them probiotics while they have dysbiosis and you do not address the dysbiosis, there's an interesting study that you can read. This was an animal study, so of course we have limited data on humans, but this was an animal study. And it was published in, looks like in just recently, it's like 2016, looks like. in the journal Scientific Reports. And essentially what they're saying in this particular study is that once they introduced the probiotics, it supported healthier function. But once they removed the probiotics of Lactobacillus strains, they saw a rapid decline in the amount of these Lactobacillus strains, and it aggravated the dysbiosis, right? So what we're learning from this animal study is that if we can take some of the implication into humans, is that if we don't address the dysbiosis and you just give in people probiotics, like a lot of nutritionists will just give people probiotics. But if we don't address the dysbiosis, it could, once they stop taking the probiotics, it could aggravate their dysbiosis. This is the value of really learning how to identify SIBO and SIFO, how to evaluate it with the proper lab testing, and how to properly treat it, right? So hopefully that answers your question. I know that was a long answer to a short question, but I really wanted to make sure that I give you kind of like a really wide understanding of what probiotics do, what they do not, and what's the role of probiotics, right? They can do a lot of, I've seen studies of probiotics that were incredible. Like they changed the levels of hemoglobin A1C just by taking the probiotics, right? Incredible studies. I know Dr. Chill had some incredible wins with using probiotics as well.
Absolutely. They can be very beneficial if done correctly.
Exactly. So the key word is when done correctly, they will definitely, at least from my personal experience in looking at some of the studies, if a patient has an overgrowth of bacteria or fungal or an infection, it's important to have the appropriate treatment, right, for it, rather than probiotics, right?
Absolutely.
So, yeah. So to summarize it, make sure when you see patients with gestational diabetes, make sure to look at nutritional deficiencies. Make sure you look at inflammation and oxidative stress. Remember, C-reactive protein is just one marker out of multiple markers. If you test your patient with C-reactive protein and it's low, it doesn't mean they don't have systemic inflammation, right? Because there's so many other players like interleukin-6 and tumor necrosis alpha. There's so many other factors that can play a role in inflammation. There are functional medicine testing for the immune system to see what levels Tregs and what levels interleukin-10 and anti-inflammatory cytokines. So we can get a better picture of that if you want to do that. And then, of course, looking at their gut. I know Dr. Chill and I always talk about the gut. It's this eternal thing.
I think one of the most important factors in health is gut health.
Yes, absolutely. And of course, one thing that Dr. Chill already mentioned, which is really interesting when it comes to nutritional deficiencies, is that the particular study that Dr. Chill mentioned, he already mentioned it, but I wanted to mention it again to emphasize it, is that while 5,000 units of vitamin D daily showed a significant reduction in the risk of gestational diabetes, the researchers also mentioned that the group that when they measured the levels of vitamin D in both groups, like the groups that received placebo, the level of vitamin D was very similar in both groups. So you kind of read the research and you scratch your head and you're like why? How is that even different? How is that not different? We would expect to see a higher levels of vitamin D in the group that received supplementation, right? And there's, of course, maybe different answers that I don't even think about to that. But I'll never forget one of my mentors who have been researching nutritional medicine for years have told me is that when we're measuring vitamin D in our blood, it might not be the right or most accurate way to measure the levels of vitamin D in our body, right? And we know that because we also see studies that show that the levels of intracellular vitamin D or other nutrients is different than extracellular, right? So we're not going to get into that topic. That's a big topic by itself. If what you're measuring in the blood is actually what's in the cells and is being utilized, that's a whole different topic. We talk a lot more about that in the advanced program. But I just want you to think about that if you order a blood test of vitamin D, and it looks normal, it doesn't always necessarily means that the patient has proper amounts of vitamin D, right? That they're utilizing proper amounts of vitamin D, right? So, or other nutrients for sake of that conversation. So hopefully you get some great strategies with the vitamin D, the omega-3s, myo-inositol is another one. We talked about fatty acids, right? We talked about some important dietary factors. So I want you to take these, utilize them, and help as many patients as you possibly can. And if you do that, then I know that we have already spent the hours that we spent on preparing for this discussion was already worthwhile to do, even if we're just able to help one or two people. So as usual, I want to thank Dr. Chill for being here, sharing his years of clinical experience as a functional medicine physician.
Thanks for having me.
And I want to thank our media team and Jacob for allowing us, using technology to bring us to you so we can connect to you all the time, every week together, and help you grow your skills. And I also want to say a really big thank you for being here, for each one of you, for being here, showing up for your patients, for developing your clinical skills, and offering a service and guidance that your patients are not going to get anywhere else, right? By being here with us, learning about the functional, nutritional, clinical approach, you are bringing guidance to your patients that could be life-changing. And unfortunately, they're not going to get that from any other physician or nurse practitioner or PA that is just going to prescribe them medication and send them home, right? So you're going to talk to them about what's causing their disease and meaningful strategies to improve their health. If you want to learn more about it, we got a couple of really great programs when it comes to metabolism. We got the Advanced Functional Medicine, Functional Nutritional Medicine. This is a clinical focused program, advanced, only open to practitioners, healthcare practitioners. And then we have our functional weight loss. It's a functional weight loss program. Let's see if we get a picture of that program to show you, just talk a little bit about it. So this is a program where we talk about the 5 root causes of weight gain. It's got functional, specialty, and genomic lab testing. We also talk about optimizing metabolism with nutrition, herbal medicine, talking about sugar addictions. We're talking about mood disorders. We're talking about hormonal imbalance that leads to weight gain. It's 100% online. We're going to be with you both live every week and on demand. So you can access the material. It's a 2-month program, 8 weeks. You got to get certified. It's a lot more interactive because there's both live and like on-demand quizzes. So it's a lot of fun. And reach out to us if you want more information. We got an amazing medical scholarship that we offer right now, a big discount. So reach out to us if you want more information about it. And as usual, let's go back to me and Dr. Chill. So as usual, I really want to thank all of you for being here. It brings us a lot of joy knowing, and we hear the feedback from you guys. It brings us a lot of joy to know that you're out there and you're helping your community to improve your health. And by the way, if you're in our advanced program right now, make sure to reach out to Dr. Chill for some coaching. Dr. Chill had some amazing experience coaching practitioners on how to help their patients with a variety of different conditions, right? So Dr. Chill, I mean, you've been doing get some really great feedback on the case studies that you've been doing.
Yeah, absolutely. I mean, many of these practitioners are trying to figure out how to incorporate functional medicine into their day-to-day, right? How to apply all of the information that they're learning and then put it to their patients. So we go through all of the different tools that are associated with this program and then how to utilize those tools so they can actually start to apply it in their clinical setting and actually start to make improvements with their patients right away. And we'll go through from beginning all the way through labs, all the way through follow-ups with their patients. I have practitioners that are bringing me multiple cases, and we're going through all of them together. Because we
Yes,
really want you to feel as comfortable as possible in functional medicine with this program.
absolutely. And I've seen since we started doing this in the mentorship, when we added the mentorship to the program since last January of last year, we had amazing feedback of practitioners who are now, just from their first month or two, they're already starting to utilize the principles of functional, nutritional, herbal medicine in for their patients, and the feedback is quite amazing. So we don't charge extra for that. Use that for your advantage. Reach out to us. Schedule a coaching call with Dr. Chill. We have all the resources for you. Right? We're paying for a HIPAA compliant portal so you can upload the patient's labs. We're giving you the consultation form. We give you the functional medicine evaluation tool to use with your patients. And we're also giving you all the treatment protocols and one-on-one guidance. So reach out to us. We're here to help and take your skills to the next level, help as many people as we can. So really appreciate you all for being here. Take care of yourself and have a wonderful evening. And we'll see you in the next class.